not
Dr. Lahariya,
saying...
would you say that it's actually much, much more than 10%? 10% is based on the basis of tests. The actual testing is often nowhere. It's a fraction of what the real numbers are.
Yeah, but exactly. That's what I'm saying, that we know that because this particular Omicron wave rise very quickly in 2 to 3 weeks, which essentially means that a large proportion of population is getting infected. So the test positivity rate or number of new daily COVID-19 cases are really a fraction of what is
numbers
happening
are
in the
the same,
community.
but it's the trend or the pattern which you believe.
It's the trends and patterns. So
Dr. Lahariya, has Delta effectively, is it effectively on the way out in India? I mean, has it been effectively replaced in India thus far?
So what I know from different sources, this is not available that much in public domain, but various experts are saying that 90% of the samples which are being sequenced are Omicron. So essentially Delta is almost out, and especially in urban settings or even urban districts or major cities, it's completely Omicron. It's a rural settings and other remote districts where it's mainly Delta. But it's very likely that in coming weeks, even rural settings would have Omicron. So I want to make 2 quick points here. One, that for especially we should be keeping a watch on what is happening on TPR or new COVID-19 cases. But equally important is that we watch on the ICU admission rate and hospitalization rate.
And that's the bottom line. Yeah. I mean, if that's the measure of how many people are falling seriously unwell.
And second quick point here is that considering what we know, that this Omicron wave rise very quickly within 2 to 3 weeks and decline very quickly, that essentially means that a part of the state which is going into polls since, let's say, in early March, we cannot predict anything about that. If they have a high number of cases right now, by the time the polling time would arrive, they might have a very low number of cases. So we cannot plan for all the parts of the state.